Well, welcome to our event. We're excited to bring you this event that's introducing a new set of tools and videos that were released through our Family Treatment Court Practice Academy. Now, while everyone joins today, we're going to take a minute to do two polls. So if we can please launch the polls, you'll see them both up at the screen on at one time. First question as we dive into behavior change. What behavior change strategy do you use most often in your work? Thinking about incentives, sanctions, maybe some motivational interviewing work, treatment adjustments, complementary services, or if it's something different, you can drop it in the chat. Hopefully everyone can see that poll. Love to hear. What are you using most often to support behavior change? Looks like we've got a lot going on in the chat. Gift cards, active listening, incentives, responses, some MI, therapeutic interventions. On our poll, we have quite a few folks reporting incentives and motivational interviewing, treatment adjustments, complementary services. Then there's a second poll as well. When responding to participant behavior, what's your biggest challenge? Is it consistency across team members, being able to collaborate and agree, knowing which strategy to use, time constraints of, when you know about an issue, when you start talking about it, being able to have enough time to staff it adequately, a lack of training or resources, or anything else that you could please drop in the chat. We got a good amount of people participating. Thank you. Time between the behavior and the response. Got it. All right. Well, it looks like our first poll, we're using a lot of incentives and motivational interviewing. And for the biggest challenge, it looks like consistency across team members, bias is in the chat, and access to resources, knowing which strategy to use. Well, thank you all for sharing. I'm going to end that poll. Oh, I'll share those results so you can see them. All right. So as we get started, I'll introduce myself. My name is Tessa Richter, and I'm a Senior Program Associate here at Children and Family Futures. My background is in child welfare. I was a caseworker on a family treatment court team and then a coordinator as well. And I have been at CFF for 8 years, and we always like to start with our why. Why do we do this work? And for me, I truly believe that doing this work helps break cycles and heal families. And in looking at behavior change science in this work, being able to see how to find the root cause of a lot of issues of what's going on, to me, truly just speaks to breaking those cycles and supporting families. So for those of you who don't know us, we're Children and Family Futures, and this is our mission statement. We strive to prevent child abuse and neglect while improving safety, permanency, well-being, and recovery outcomes with equity for all children, parents, and families affected by trauma, substance use, and mental health disorders. We always like to start with our mission to encourage you all to really think about your missions and if what you're doing is speaking to that. So as we look at this topic, when looking at trying to decide what to focus our topics on, we know that behavior change is complex. You all know that as well, especially for the families we work with, those navigating substance use, mental health, and other challenges. Treatment courts have long been working on this about behavior change and have long relied on proven strategies like motivational interviewing, structured incentives, and some of those other pieces that we look at. But there's a broader toolbox available, and so that's what we're here to explore today. So today you will get a first look at the Behavior Response Toolkit. Maybe you saw it in some of our social media posts or in your email. If you have it, go ahead and open it up now. We'll be dropping that in the chat as well for you to look at. But we really hope that you can use this resource, which was built for professionals to respond to participant behavior with clarity, consistency, and purpose. And this is all grounded in behavior change science, which we'll talk a lot about today. So we're going to walk through a few of the key points of the videos that we made and the toolkit, and then we're going to hear from a couple practitioners who have been piloting this so that you can hear what's working, how they like it, what they would like others to know about it. So we encourage you to listen, ask questions. You can drop things in the chat to talk with each other. We'll have some Q&A at the end of the session as well, so feel free to keep those until the end and we will respond to them then. We would also love if you completed our evaluation link. I'm putting this here now. Obviously you can't complete it yet, but if you want to scan that QR code just to pop it up on your computer so you have it, that would be great. And we'll show this again at the end. And also if you would like a certificate of attendance for this event, we will put it in the chat at the end of the event for you to download. So looking through our agenda quickly, we're going to introduce our new resources. I'm going to walk through a couple key points in the videos and then also in the Behavior Response Toolkit. And then our lovely friends from Oneida County, New York are going to engage in a panel discussion talking about the toolkit and some of this behavior response work that we've been doing. And then we'll have a practice scenario. So we have a scenario and they are going to walk through it live, like if they were staffing a family or a client. And then we'll do some poll questions with you all too to help you engage in thinking through these things. But our hope is that by the end of this, you will feel comfortable downloading the toolkit, watching the videos, and start using it in one way or another. After that scenario, we'll have open Q&A for about 15 minutes before we close out. So again, you can use the chat box. We have staff available to help you or to answer questions in the chat as we go. But if you have questions for the panelists or myself, please save those to the end just so we don't lose them in the chat. All right, so the first thing we want to do is share about our video resources. So as part of the Family Treatment Court Practice Academy, we released 5 short videos, and I actually mean short for the first time. They're actually short. They're about 20 minutes total, so none of them are over 5 minutes. These, you can see the topics here, and we'll walk through a couple of the key points from them. But it's we're talking about accountability versus punishment, which lays the foundation of some of the behavior change work. The second video talks about behavior change theories. So looking at those couple of theories that have really been the foundation of treatment courts, sometimes digging back into the theories and understanding why we use them can help us use them the best we can for our families. The third one is expanding techniques, and that is talking about what else is out there in the behavior science world that we could access in our treatment courts. The fourth video is sort of a condensed version of introducing the Behavior Response Toolkit to share. And then number 5 is my personal favorite, when nothing seems to work, which I think all of us have probably felt before. What do we do? We're doing all these things, nothing seems to work. Where do we go from here? So it's a little bit more of a deep dive, as much as you can deep dive in 5 minutes, into motivational patterns and some ideas of how to stay grounded as a team. So one thing to note, all of these videos are available on our website. They are great lunch and learn material. You could watch one of them and then discuss. You could watch 2, 3, I mean, it's only 20 minutes, right? You could watch all 5 of them and then discuss as a team. So they are super accessible and we hope that they're really helpful for you all. So a couple key points to walk through. There we go. Our first video is on accountability versus punishment. So the video goes through and talks about how accountability and punishment are really different. and if we're focusing on accountability, what it means. So on the right side here of the slide, you can see a chart, and this is in the toolkit, so you can access it. But when we think about the focus of accountability versus punishment, we look at our families or our clients understanding the impact when when they have certain behaviors, what are they learning about it? There's growth, and it's very future oriented. Whereas a punishment approach is more about consequences for past actions. So we're looking at helping participants take responsibility, make amends versus going into that blame, defensiveness, denial state. Um, so there's just a couple pieces here to look through. This alone could be a great video and chart to do with your team, to walk through and say, okay, how are we really approaching this? How can we stay in accountability mode? How do we know if we're slipping into punishment approach? A lot of times that happens when it feels like nothing's working or we're scared. There's that fear. And that's a lot of times what happens when we get into that fear-based, we're controlling, um, we're looking for compliance, right? And so it can be a good chart to keep around to recognize that. On the left side here are some suggestions for staying in accountability mode. So staying curious, asking questions, offer that structure without shame, and hold boundaries with hope. Identify the motivational patterns, which is something we'll talk about in a minute, and return to this model, the COMBI model, which we'll also talk about. So the second video, I do not have a slide for, but the second video goes into those foundational theories that treatment courts were built on. So looking at like operant conditioning, which focuses on incentives, and using incentives and sanctions, helping those sort of things. Look at goal setting, which is like your distal and proximal goals, all of those things. So that's in our second video. Now, the third video is about expanding our toolbox. So it highlights three pieces, which are all connected, that lay the foundation for this toolkit that you all have access to now. So the first one is the Human Behavior Change Project, which is this big project out of England that has behavior change scientists that came together, and they've been working on this for a couple decades. But they pulled together all of the different behavior change theories, which there's over 80 in the social sciences field. So we use about 3 or 4, maybe 5 in treatment courts traditionally, but there's over 80 out there. So the Human Behavior Change Project brings all of that together, and they use machine learning and AI to pull sort of like what is working in all of these different theories. What techniques are there? What are the mechanisms of change? All of these things that are happening. So if you just Google Human Behavior Change Project, you will find a website with vast amount of resources for creating interventions, all of those things. But the scientists there, I'm sure, thought, for normal people working in the field wanting to improve their interventions based on science, they might need to get something a little more specific. So those researchers and scientists created something called the Behavior Change Wheel, which we'll look at in just a second. The behavior change wheel has 3 components. The middle is the hub, which is the COMBI model. The middle are different interventions, and the outside is policy. So those are some of the tools that we're going to be using and looking at. So the behavior change wheel itself was developed from 19 behavior change frameworks. So again, there's over 80. The scientists looked and decided that these 19 had the best evidence behind them, and they created this. So that hub is, again, the COMBI. And the COMBI stands for capability, opportunity, and motivation for behavior. They each have 2 components in there, and you'll see all those definitions in the toolkit. But the COMBI is a framework that we use through this toolkit to say, okay, what's going on that's getting in the way of change? If it's capability, like how do we figure that out? And we ask ourselves questions, we ask our families questions. Do they have the physical, mental ability, skills, and knowledge to adopt the behavior? If it's opportunity, does their environment support or allow their behavior? And when we're looking at motivation, do they want or feel driven to change? In the toolkit, and what you'll notice next, that next level of the wheel is the interventions. And the interventions, you'll see some of these, it's these nine. Well, there should be nine. There's one on the bottom. That's environmental restructuring. That is not showing for you on here. Um, some of the words might seem familiar. Some of them might seem a little strange. The beauty of this model, though, is that not only are they saying, okay, you identify that there's a capability concern, which of these nine intervention functions do we want to use? It actually shows throughout all of these behavior change um, theories that of how to match those things. So if capability is a concern, then training and education might be your best interventions. And so we have all of that for you in that toolkit. So the outer ring is policy, and I just want to call everyone's attention to that. Those are things like fiscal changes, statutes, um, legislation, those pieces that are probably a little bit outside of the realm of most treatment court practitioners, but I did just want to bring your attention that there is a ring of policy interventions as well. So for that last video, that's something we just want to highlight is these three common motivational patterns. So when you look at the M in the COMBI model, there's two types of motivation, automatic and reflective. And so reflective is the motivation that when you can sort of talk to people about the change they want or need to make. Do they recognize it? Do they think they want to do it? Do they have a plan for it? Do they believe they can do it? All of those things. Whereas automatic motivation are more of those habits and impulses and like those implicit beliefs that they might not have cognition over. And so looking at those motivational patterns, I'm wondering if you think about a client right now that you've been working with that maybe you've been really struggling with to get them engaged and see which of these patterns might fit for them. If they have high automatic but low reflective motivation, they might be emotionally activated and motivated by fear, urgency, or guilt. So this might be your people that come in, get offered treatment court, get offered services. They say, yes, I need to do this. I'll do anything I can to, reunify with my child or to get into treatment or do any of those things. But then they kind of stall because they lack that reflective motivation of a plan or a belief or clarity. And so the toolkit or the videos dive in a bit to like, what do you do with that? The next category is those with high reflective motivation but low automatic motivation. So those are your folks that have that plan. They understand the need for change. They can carry out some of those things, but their habits, cravings, and emotional dysregulation hold them back. They seem really reactionary and overwhelmed. And then our third motivational pattern is low reflective and low automatic. So they might seem disengaged emotionally, cognitively, they might seem indifferent or avoidant, hopeless, overwhelmed, and disconnected. So if you watch that fifth video, it goes into some strategies for each of those. And I think you'll get some insights also from our panelists around this. So now I want to walk through a couple pieces of the Behavior Response Toolkit. So you can, again, hit the QR code here. It's in the chat box as well. So please access that. The Behavior Change Toolkit has three main pieces. It has a flowchart, barriers and enablers to change worksheet, which is the COMBI model, and then behavior change techniques, which is what pairs those interventions with the COMBI identification. So in the flow chart, which I'll show in just a minute, the goal is that we're brainstorming root causes of behaviors. And brainstorm is an important word there because ultimately what we know is that we don't know. Uncertainty is real. We don't always know what's going on. And a lot of this is brainstorming, trying to figure out what could be the causes, what could be underlying these things. So there's a lot of room for brainstorming, thinking, and revisiting here. The next step is, after going through this, is to choose that targeted evidence-informed response. Staying away from that punishment mode, staying in accountability mode. What can we do to help break that barrier of capability, opportunity, or motivation? And then lastly, communicating this clearly with parents. So you'll see a piece on the flow chart to write that out, because sometimes we skip that step, right? We skip why this is the response. So here's what that first page looks like, the behavior change flowchart. This is meant for you to actually print out and fill out for your parents as you walk through things. It has 6 questions on it. It's 2 pages, so you can print it out. And we'll walk through this, but it's looking at what behavior is preventing progress, why is this behavior important, and then looking at which of the combi model might be applying here. Um, and then diving into what intervention do you think could be a good idea or could be a good fit for the behavior. So think of this as like your map. The second worksheet is the barriers and enablers to change. And this one has a lot of information on it. So the goal is as you go through the flow chart, you get to the part about COM-B, you're going to bump over to this worksheet, the barriers and enablers to change, to help you identify, is this a capability, opportunity, or motivation issue? And of each of those, which of the two might it be? So you can then check the box, say, okay, we think it's probably opportunity that's causing the struggle here. So then you go to worksheet C, which is the behavior change technique. So you can see there with the chart with the blue, that's what it looks like. Just so everyone knows, there's two versions of this toolkit. There's one for online viewing, which has this chart with the blue boxes much bigger and easier to see online. And then there's one where they're smaller so you can print it. So those are both on the website. I think the one that we posted in the chat is the online viewing one, so you can see it a little bit better. But so you'll see on the right, that's what the flowchart question says, what intervention category might help change this behavior? And you go to worksheet C to help you figure that out. So I know all this might seem a little abstract right now, but we're hoping to walk through it a little bit more, help you understand it, because ultimately this is about moving from reacting to responding with purpose. So thank you all for hanging in there with me as we walk through all of that. We are going to move into our panel discussion next, where we have a couple folks from Oneida County, New York, who have been working on this with us. So I'm going to go ahead and close out my slides for now. And Natalie, would you please spotlight Ambi and Tatiana and myself? And we're going to start with some introductions. So Ambi, I'm going to start with you. And if you wouldn't mind sharing your name, your role in your family treatment court, a little bit about your family treatment court, and tell us what your why is.
Thank you, everybody, for joining us. I'm so excited to do this with all of you. I'm Amy Daniel. I'm the resource coordinator to over Family Treatment Court and Empowerment Court in Oneida County. I believe this is our 20th year for our Family Treatment Court, if I'm remembering correctly. We're usually pretty well stocked with participants. We're around that 35 mark. We've had as many as almost 60. And probably one of the things that has been most memorable, and if you've ever heard Judge Deep speak, our court has gone through an incredible transition over 20 years, and Judge Deep and Tabitha Salick really took us to a place where we're recovery focused, we are not sanction based, and it's really about wrapping the participants in support. And that was such a breath of fresh air. And as many have experienced, a little uncomfortable at first, right? Because it can be hard to know how to support change. Um, and I'm excited to be able to do this with you and share this with our team.
So much, Ambi. Tatiana, will you introduce yourself?
I'm Tatiana Morris. I am a resource coordinator as well to the Oneida County Family Treatment Court. I primarily focus on like grant stuff at this time, which is, bringing in incentives, collecting data on how our program's working, and so much.
Wonderful. Thank you so much. And you might have noticed there was a third person on our agenda to be on the panel. Kristen, unfortunately, she had some family recovery court business to attend to, as I'm sure everyone understands. So she did, we miss her, but I know we're in good hands. So as I start our panel or our discussion, start by asking, what would you all want other teams to know before they start using this toolkit?
Well, here's what I'm gonna start with. One of the things I'm sad Kristen's not here for is between myself, Kristen, and Tatiana, we had a really big gamut of Tatiana's very new to the toolkit. Kristen has been using it in supervision, and I've been working with Tessa for almost 10 months on this. So I'm sad you're missing that middle piece. So Tatiana, with your really fresh lens, I'm gonna have you kind of start on what do you think is most helpful to know being super new to it?
Being super new in what I do know, I think that overall the toolkit brings in a lot of communication, and it also like brings in a lot of like members who work with each other, because you'll notice like there's so many different aspects of like how people are being affected. So it adds extra communication with other team members from other departments, other facilities. It's really good for opening up a lot of conversations.
Yeah, I think Tatiana hit one of our biggest pieces. And I think this is also going to be really helpful. We all use it a little bit differently. The order of it can be massaged into whatever works best for you. Tessa did an insanely incredible job making this so usable and so moldable. It has been one of the best toolkits I've seen in almost 20 years of being in this field. So I am so thankful to Tessa for really putting this together. We use it almost every day. In the official toolkit, when did we start with this, Tessa? About not even 2 months ago, right?
Yeah, I think so.
And it's been an incredible way, exactly like Tatiana said, to drive conversation, but also to bring in our team to look at those behavioral response pieces. It's been incredible, and we'll give you some examples along the way too.
Yeah. Thank you so much. Really appreciate you guys diving in for it was definitely a building flying the airplane while building it thing, and they jumped in to give it a try, because exactly what Amby just said, right? Like everyone's going to use it a little bit differently, and it should apply to your local context. So please do what you need to do, anyone, to use this the way it's going to work best for your team. But I love, Amby, that you can identify, like even after your team, which is a well-oiled machine, that really takes that accountability view, right? This was still a useful way to bring everyone together. So I think that's really great. Can you share some of the things that have been most helpful or impactful for your team about using the toolkit?
So our gut for when we use this is when we've got a participant where we're like, they are so stuck, and we've all had them, right? We don't know how to help. And we have even had meetings where we've had people say, I don't know what to do at this point. Um, and that's been the greatest gift of the toolkit is reframing us to look at the bigger picture in a much more complex way. So when we're targeting capability, opportunity, and motivation, it really helps us to create a roadmap of simple interventions to start trying, because sometimes it's the simple thing that we forget sometimes, like someone's basic needs aren't being met. And maybe that's why they're not going to their appointments. They're in fight or flight mode constantly. Or maybe they're really struggling with medical health and they can't think anything about how to make a phone call to get transportation. They're really stuck with their mental health or their physical health. Um, so that's been really huge. Simple behavioral change opportunities, really clear documentation, not only on the issues, but the interventions, but the strategic discussions that help us frame plans with the participants and our team have been ginormous. The surprise, and I saw this in the chat, Roxana, I think, wrote it in there, the empathy and validation that has come from going through this, the things that were not on our radar. We've looked at support in different ways. We have one family this week that we talked about, this part of the family is an incredible support, but they're also an incredible barrier in the pressure that they put on their loved ones. So it's opening up conversations we would not have had otherwise.
Thank you. I love that. I think some of the questions with the combi model helps just get into that nuance, right? It's not just is the client motivated or are they not motivated? It's right, like what are the nuances of that and how can in order to best support that, we need to know. How has the toolkit affected your team's collaboration and communication, especially from a team that has been doing a lot of this work for a while?
Tatiana, I'll have you take that one because in staffing, you kind of hear how we're talking about the cases a little bit differently.
I think it It has helped like with deeper conversations and then letting everyone kind of just about what we just talked about is looking at some things that we would have overlooked. And so it gets everyone thinking. And then what's really nice about it too is that everyone's thinking. Like we're all putting all of our brains together for this. So sometimes we all come up with different things and it all like ties to it. But overall, it definitely like improves the communication with everyone throughout the team because everyone's working.
Yeah, I think you hit the nail on the head. Like once we all start talking together, we have, I think, 3 cases this week that we use the COM on, and a lot of the issues were connected to mental health and to treatment and use. And so we were able to toss it to treatment and to their therapists who are a part of our team to say, hey, they're really struggling with emotional regulation. Hey, they're really struggling with intimate partner violence and can't take steps forward. So, what can you offer them when you meet with them to kind of work through some of this? And that's been huge. We've had some really, simple things to be able to come out of it.
Excited to get into some of those, but one last kind of reflection question on it. How can you see that this toolkit helping teams move from that punishment mindset to more of an accountability shift mindset?
This one was a little tougher for us in the context of our family treatment court because we really have the last almost 10 years have focused on that, the accountability, the support. Um, there's a but to that. We all get in modes of do they need a violation? Is it the threat of jail that's going to help them go inpatient? So every now and then we still have that mindset. I'm just as guilty of that as anybody else. Because when we get stuck, we don't know what else to do. We also, as I'm sure a lot of you are experiencing, sometimes our participants don't have urgency to move forward. Um, and what the toolkit has done for us is make things a lot more complex. So we start to look at more at what is it that's really a barrier for them? Do they need more education? Do they need a text message once a week saying, hey, you've got an appointment on this date? Because they really are not capable in the beginning to be able to make everything happen. We have a lot of families that might be struggling with getting to their appointments or they're going I've got a great example. We have a participant who continues to go to a place where after they've been there they are testing positive for use. And I don't know if you've ever seen the Bob Newhart skit. You just want to say stop it, like just stop it. And if you haven't seen the skit, look that up. Bob Newhart therapist, it's phenomenal. And it's short, it's hysterical. But sometimes we just want to say, that's the easy answer, right? Like, just don't go there. But what the toolkit did is it helped us to break that down to look at what's going on that this person is going there. Um, do they really believe that their kids are going to get removed if they continue to test positive? Do they really have a motivation to stop going there? And it really opened up a different lens and also considering some IPV, how can we work with this person's therapist as well? So it really shifted that conversation for our team in supervision. So I mean, Tessa nailed it with the questions in each of the categories to help provoke thought and with the simple interventions. It's been amazing.
I loved how you said that this helps make everything more complex, which I think is usually like the opposite of what people want, but I'm hoping that it helps because the simple answer usually might not be the answer, right? It's not so black and white, it is in the gray, it is in the nuance. But our hope is that this format, this template, gives you a simple way to dive into those complexities. Yeah. All right, well, let's dive in a little bit to using the toolkit. Can you both give us some examples of how you've used it so far to address behaviors and what light bulb moments have you had?
This is where Tatiana is super new to it. Do you want to share a little bit about your experience just kind of going through it a little bit and like your
Just
initial
going
impression?
through it, like initially, like looking at it, I necessarily like wouldn't have thought some of these things. A lot of them, like I feel like I'm kind of repeating myself, but what it is like overlook these things. And a little background on me is like I did work in a treatment facility for the past 3.5 years. So like this switch over here, like I would probably look at it a little different in the treatment facility, but here you have to ask like the why, the how, and everything. And this toolkit like really brings it out. And it's like, okay, so what is going on? How can we help? And like it helps a lot instead of just like streamlining it and being like, okay, this is the only answer.
Yeah, that's been huge. In the situation that I just shared a little bit about, we tapped in the treatment provider and the therapist and said, "Hey, what have you been working on with this that we can also reinforce as other team members, but also here are the things that we're still seeing." It was such a huge light bulb moment of her simple plan of, "I'm just not going to go there anymore." Wasn't going to work, and it didn't work, and we've had multiple situations since, and that was just such a huge light bulb moment of this is so much bigger. We've had other participants who aren't ready to stop using, so even looking at that, and I think the toolkit also gives us the opportunity to look at here are all the things we've done, and here's where the participant really has to take the reins. So what are the opportunities to do some of that? So participants who aren't ready to stop using it, can we do the written summary of, okay, well, here are your expectations. We're not going to push you, but there is an end of the road at some point. The department has responsibilities to file. What can this plan look like? So it's helping them reframe. It's still giving them validation for their own journey. So for example, I can think of at least 4 people right now. Their use is connected to their mental health. They are not going to stop using until their mental health is more stabilized. Okay. This is something that's really supporting you to feel as stable as you can right now. So giving them the empathy and validation. Okay, well, what's one thing that we're going to do to move forward? Who are we going to tap in? How are we going to connect you to a therapist? So that validation and empathy piece was really surprising.
Yeah. So I wanted to go through each of the 3 worksheets in the tool, and starting with that first one, the flow chart, which you might also see as worksheet A. How did that help guide team decision making?
So this one, the first thing it did, and you can do this 2 ways. 2 of us have found we need to pick one behavior at a time. And if we did that, it opened up different flows. So Tessa did a beautiful job giving you some options. We do use the other category too, for trauma, for different things. So we pick one behavior. We identify what we think it's affecting. And then that second question opens up the conversation of, well, we think it's affecting that, but they don't think it's affecting that. So that opens up a whole new lens just in 2 questions. I then kind of like Tessa shared, I go through the rest of the questions in the toolkit before I look at any of the other questions in the flow chart. So hopefully that's a helpful start. The light bulbs are incredible. And then taking it to the participant afterwards is incredible.
Looking at worksheet B, barriers and enablers to change. Did any insights or surprises come up for you in discussion? Thinking about capability, opportunity, and motivation.
Absolutely. Tatiana, you might remember this conversation because you came in, so please chime in. With capability, I think the biggest light bulb was sometimes people really aren't capable of certain things. And what I mean by that is, I'm thinking of a couple of past parents who had developmental disabilities. They are never going to make all of their appointments. It's not going to happen. It has never happened. So, what can we do to put things in place? Can we do a SPOA referral so that they have an intensive case manager? Um, it's helped us look at realistic opportunities and what are going to be barriers for life that we've got to put services in place for. So, that's been huge with capability. Huge.
I think the capability one, what stood out for me in doing this was I think there's an old treatment court adage, right, that everyone can show up and be honest. And everyone might not have the capability of showing up at the moment, depending, and if you look through some of those capability questions, might recognize, oh, they might not have that. Or do they have the ability to be honest? Maybe, but like, what's all those motivational factors behind that that might be making it harder for them that could still be addressed in treatment?
Right.
How
And I
about
think that is like very important too, because like everyone's different. And being able to look at, okay, how do they differ? And then meeting them where they are of like, okay, this is where you are with these certain things, with your capability. How are we going to move forward and continue to make progress?
you? How about an opportunity? Any specific things that stood out to you all as you talked through the O in the Compy model?
Tatiana, do you want to talk about some of our cases who are stuck in fight or flight, where we looked at some of the different opportunities?
Yeah. So some of them, I guess, trying to think of a specific one, but so a lot of sometimes people like their environment, they're in a tough situation. They don't have like stable housing, they don't have stable resources or anything. So they continuously are in fight or flight mode, not realizing how that is affecting the other parts of their recovery and their treatment and everything that kind of goes with it. And a lot of people, and then too, even like past traumas, they are stuck in fight or flight mode because we have someone who's like, the system is completely against me, everyone's against me, and he just is like, it takes time to open up and get that comfortability and just like a little bit of a nudge, but sometimes when a nudge might be too much. So it's kind of like working with, okay, how can we work with this behavior?
In one of the cases that Tatiana is referencing from the past, one of the things that I don't know that I've ever seen in a long time, it's a person who didn't have housing, and the department actually has been holding off on violations and such because we're hoping that this person not being homeless might then start to reduce fight or flight so that they can re-engage appropriately and work on their sobriety. So I think in years past, we would have seen stronger violations and TPRs happening much sooner. So this is a very different response. And I think that's the cool thing about the combi. It really is, I think Kirsten, she just said it. It's really asking us to think differently about what someone might need. It's huge.
So I want to ask you also about the M, the motivation. I think for me in doing this research and work, the motivation was like the biggest eye opener for me, and like how to dive into that a little bit more again, because I think we throw around the word motivation so much. We talk about motivational interviewing, and change talk and all of these things, but the definitions of motivation here help you really dive in more into what the person's experiencing and what the person's experienced, right? Like everything that's happened and been part of them to get them to where they are today that might affect how they're making choices. And so I'm wondering have there been any light bulbs for you all as you discussed motivation? Any examples that you could share that helped you walk through some of that?
Yeah, so Darcy and I have a differing opinion. There was a joke when we met with Tessa. Darcy was like, "I wish we started with motivation." And she's like, "Why isn't it?" Tessa was like, "Well, combi is, in order, the M's third." Right? So we laughed about that. I actually am glad it's last because this one leads to the most conversation. So remember, we are often using this when people are stuck. So when we're looking at motivation, sometimes we're finding they're not motivated because there isn't something motivating that change. So if a parent's not afraid that their child is going to be removed or that they're going to have to do something, um, we may have to look at motivation differently with them. And sometimes that's the insight for us to say, hey, they need some education in this. So, as you go into worksheet C, that's, a key piece of here's some really simple interventions you can put in place. Um, it- I can't tell you how many times we're like, oh, we think they should be motivated, but they may not be. It gives us something really tangible. It helps us look at motivation differently. But our conversations around motivation have been much bigger. Because and then the other piece of this is it's a good reminder we have to ask the participants, how much are you motivated to do whatever the behavior change is, and have a real discussion around it. So even going back to our family who keeps going back to places that result in positive screens, um, how motivated are you to change it? What are the challenges to doing that? Like, what are you facing with that? Huge.
Yeah. I saw a question in the chat from Jill. Hi Jill. About in worksheet A, the flow chart. Amby, you said you guys do, some of you do it a little bit differently. Like, do you want to choose? Do you choose just one behavior? Do you summarize it? Like, what are you all doing with that? And what do you have any recommendations?
Yeah, so for example, Darcy likes to do the entire chart in order page by page. And her brainstorming about the family without the questions first, so that her brain's going. And then she'll use the questions through uh, the, you'll see it, that this each on the capability, opportunity, motivation. She likes to do that second and then go all the way back to do the action planning. I like to pick my target behavior, identify the impacts, and then I like to go through all of the questions and do the action planning last. I like to process the whole situation, including worksheet C, and do that last. So you can do it any way you want. I also like to take the the difference between the accountability and punishment. Um, sheet and put that at the very end, because that was a really great kind of checklist of, are we hitting all of these targets? What's our focus look like? Are we putting all of these qualities in place with the plan as well?
Thank you. Um, yeah, and with uh, right, well, a lot of times the parent will come in and they'll have 5 different behaviors you could target. And I think Amby shared before that sometimes the team decides to pick one, and sometimes you kind of look at them all and then discuss if there's a theme, right? Like, is there a theme related to all of these that you can work through? So I don't think there's a right or wrong way there. It's more about just agreeing and moving forward, and maybe try it one way and then try it a different way and see what works the best for you. It might depend on how related the behaviors seem, versus not. So looking at the last worksheet, the behavior change techniques worksheet C. So one thing I didn't mention in the beginning is, if you have that open, you'll see it's like an XY axis, right? So you look at, okay, well, for capability, and if it's physical capability, here's 2 or 3 interventions that have been proven and evidence to work, and there's a suggestion there. Those are just examples. So please feel free to say, okay, physical capability and training, what are other things that would kind of fit into that category? So I do just want to note that it's not an exhaustive list. It's just that is an example of what it would look like to bring that category and that intervention together. So for you all, what categories or ideas felt most useful or felt new to your team?
I have to be honest, I couldn't pick one. So I kill a lot of trees with the combi. Sorry. But you'll see that, like, oh, maybe you'll see if I can get the camera to zero in. All right, maybe I can't. Anyway, so I circle. My combi worksheets are marked up, and as we go through it, I'll kind of show you how I do it. But I would say some of the things that have been really helpful, reframing behavior in terms of what it means most for the parent, that's been huge. Simple written plans, it is one of our most overlooked tools. We remember it sometimes when someone has a cognitive processing issue, but I think a lot of the times they're coming in, whether it's in defenses, fight or flight, it's sometimes they're not processing the information they're getting from judge. Sometimes they're not processing the information they're getting from the team. So being able to lay things out in a simple format, including the here's what could happen, that's been incredibly huge. The family piece, if you know me, that's a huge piece for me. But it's also recentering some of the conversations around that. Who can we get in for family navigation services? Who can we get in with peer services that are outside of the participants? So I would say those are the huge ones. Transportation. You had a simple one in here somewhere. I want to say it's in with capability, or maybe it was in the questions. Nope, it's in psychological capability. The cognitive supports, like simplified schedules, we work on scheduling with them, but like I shared earlier, sometimes we're sending them a text message to remind them of appointments for a while, or we're scheduling it at the same time every week because they're not able to remember it. So it gave us permission, I think, in some ways too, Tessa, to like do some hand holding for a while because they're not used to it.
I love that. I think, when I was getting trained in treatment court methodology, it was very much when you give a response, well, back then it was just a sanction, right? You give a sanction and it's something that the client needs to do. Whereas I think this helps take a step back and behavior change isn't, if you can see on that chart, sanctioning, it's under like coercion, that kind of thing, is one tool of behavior change interventions, right? There's a wide variety of things that can help support behavior change based on what's going on with the parent. And a lot of them aren't things that the parent needs to go do. It's not adding things for them. It's not them writing out that writing assignment or whatnot, but it's what do they need to do and how do we help fit in those missing pieces? And so, one hope I really have for this tool is that it gives teams permission. I think you just said that, right?
Yeah.
Hand holding, but also looking much broader on behavior change, that it's not just something you hand to the parent to say, you need to do this, but looking at actually what they need in order to change behavior. And if that means it's something more that the team is doing or the team is doing differently, that's okay. We always want to be structured and individualized, and I'm really grateful. I'm really hopeful that this allows that because it is a structured tool that allows you to individualize what's going on. All right, one last section, and then we'll move into our practice. And then I also see some questions coming up, so we'll save those for the Q&A section. But moving forward, were there any challenges or sticking points that you all have noticed so far by using this?
I think the challenge is really an us issue. I work with this incredible group of women who are all processors and thinkers who love details. So we can spend hours on one case. I know that when I do this for myself, when I'm working with a participant, I can spend 20 minutes doing it. So time is the challenge. Um, so Tessa's short sheet, if we don't have a lot of time, that's a great little kind of side key to keep with you if you need to do it quickly or on the fly. It's the one pager that has like the short questions for capability, opportunity, motivation. This morning we staffed one for over an hour. So that's the biggest challenge. It's a good one to have, I guess.
Yeah. Yeah, so I think, as your team is looking at this, do you do it once per staffing with one particular client that you're really stuck on? Or I think you guys had some ideas about how to use it maybe throughout the week and not necessarily in staffing. So I think those are all considerations. Again, please do with this what's going to work best for you all. There's no one cut and dry method. What adaptations to the tool might you make to fit your local context?
Not necessarily our local context. What I want to do is rephrase some of it, bring it down to maybe a fourth grade level so we can use this a little more directly with some of the participants. Right now, what we're doing is we're doing this as staff and sometimes in a case conference. And then we're kind of presenting it to the team as, hey, what can we do to meet these goals? We try not to be prescriptive to our team members. So for treatment, it might be, hey, we're noticing emotional regulation issues. Through the COM-B, we're recognizing that they may not have the capability considering their trauma response right now. what can you do with their therapist to put something in place? And then with the participants, again, this was brilliant. So I can't say enough about this toolkit. What Tessa did at the end was, what's your explanation to the parent? So after we come up with a plan, we like to bring it to the parent, say, hey, we had some of these thoughts. We wanted to brainstorm with you and give you some ideas of things we've talked about. What are your thoughts? Where do you want to start? So it opens up a whole conversation as well. So one of the things Darcy said even earlier was, I wish I could do this with the participants so that they could have the same light bulb moments we are, or maybe they'll have new light bulb moments that we're not even having because it's their life. So that's the only adaptation I hope to develop in time.
Please share it when you do. That is super. What a great idea. That would be so useful. And last question, how do you all see yourselves continuing to use this in your day-to-day or maybe weekly work?
So this is a little different, and I wish Kristen was able to make it. We use it in supervision. We write it up as a report for staffing if we need to put an action plan in place. We can tap Judge Deepin to kind of reinforce some of the action plans once it's all agreed upon. So things we can follow up on. We use it for case conferences, but Tatiana has heard me in staffing, and maybe you can give an example of where I'm like, you know what, that's going to be a great use of the COM-B. Let's talk about it in supervision. If you could do that and bring it in, and let's talk about it.
Wonderful. All right. Well, I want to move us on to the practice discussion, the practice scenario. And again, I know there's some questions in the chat. We'll get back to those during the Q&A. I'm going to bring the slides back up very quickly just to share, see what you guys are seeing. Just to share the scenario. And I usually do not want to read to you all, but I cannot get this to work today. Please hold. This one. Okay. So here is our scenario, and Ambi and Tatiana are gonna walk through it like they would in a staffing. So our client is Marie. She's a 29-year-old mother of 2 children. They are 4 and 7, and she entered the family treatment court about 4 months ago when her dependency case opened involving opioid use and neglect. Her children are placed in kinship care with her aunt, and our aunt's expressed willingness to support reunification, but she has some concerns about Marie's consistency. Marie initially showed strong engagement. She attended treatment groups, completed her intake assessments, and participated in parenting time. And her relationship with her kids showed a lot of strengths. However, over the past 6 weeks, she's missed multiple therapy sessions and parenting time appointments. Her drug screens have been negative, but she's not attending recovery support, or hasn't for the last 2 weeks. Marie lives in transitional housing and she works part-time at a local restaurant. She has no car and she uses public transportation, which has been unreliable. Marie has expressed feeling overwhelmed and ashamed, especially when she misses appointments. She has a history of trauma, including domestic violence, and she's been diagnosed with PTSD and anxiety. During a recent court hearing, Marie was quiet and withdrawn. When asked about her missed appointment, she said, "I'm trying, but everything is hard. I don't want to mess up again." Her case manager noted that Marie often avoids communication when she feels like she's let someone down. All right, I am going to stop my share. And I'm going to turn it over to Ambi to lead this. And then please pull up the toolkit if you have the availability to, just so you can see them walk through it. And then we are also going to pop up a couple poll questions that align with the flow chart, so you can help brainstorm and think. So Ambi, I'll turn it over to you.
So if you guys pull up worksheet A, usually the first thing I ask if we're doing this in supervision is, okay, which behavior are we focusing on? So why don't we do that first poll question? You guys can decide which behavior we're targeting.
So you'll see all of the questions together. Just answer the first one right now. The poll pop up for everyone. you don't see it on your screen, you can go to the bottom and click the button on the toolbar that says polls. There we go.
And Tessa, I don't think I get the results, so you'll have to tell me which one we're working with.
I'll share them and hopefully it'll pop up in a minute.
Okay.
Right now we've got a couple saying missing appointments and a couple saying lack of engagement and recovery activities.
All right. And then I usually go right to question 2. Give me all the things where the outcome and goal are being affected. You can choose as many or as few as you want. This just helps kind of shape the conversation. Can we copy and paste the scenario in the chat?
Yeah.
That would be great.
I'll leave the poll up for another moment.
I'm going to try to copy and paste it. Hold on. Got it. Let's hope it pastes. Oh, I've got too many characters. Hold on.
Oh, yeah, you might only be able to choose one. We probably set it up that way. Sorry, guys.
Hold on. I got to give you a second half of it. There you go.
All right, I'm gonna go ahead and end the poll and share results. Ambi, did that pop up for you?
It did, but I don't see results.
Oh, okay.
I just see the.
So you've got about 40 for question number 1, you've got about 40% saying missed appointments, 25% saying lack of engagement in treatment, 10% saying lack of engagement in recovery activities, and then 1 for drug use and 1 for lack of engagement in family time.
All
And
right.
then
So
question,
oh,
for question 2, you got 35% on recovery, 14% on well-being, 10% on child permanency and self-sufficiency.
All right, so it sounds like missed appointments is going to be our target for this one. So outcome goals being affected. So one of the first things that we look at is this our opinion that it's affected by it, or from our lens, or how are they thinking about it? So how much do we think Marie believes that these goals are being affected by missing her appointments? What are your thoughts on that? And Tatiana, you can jump in, but anyone, please put it in the chat or jump in. Tessa, can they all speak or no?
Yes. You'll have to just unmute yourselves. You guys can raise your hand and you'll pop up, or you can unmute yourselves and start sharing. We'd love for you to participate.
Jump on in. Because sometimes this is one of the most eye-opening questions. Do they really believe this is affecting things? Because one of the things that we know is her screens are negative right now. So how much is missing appointments affecting those outcomes? What are your thoughts?
So she probably, in some cases now, she probably looks at it as like, missing the appointments isn't as bad due to like her knowing like that everything is hard but she is trying. So an issue could be like, making those excuses for herself without noticing how it is impacting her because she's just not open to it. And that's where the toolkit would be really nice to use in this situation because it helps her like look at all of these barriers and understanding them.
Absolutely. So there might be a little bit of a misdirect connection. And Kirsten picked up on well, wait a minute. She knows she's struggling, she's trying, and she doesn't want to mess up again. And that happens very easily when they come in front of judge, right? It's a lot of those days in between that's still a hard thing to put the pieces together. And we got, seems like she might not think it is, rather sounds like she's afraid of failure. Yeah. So, okay, immediately I'm thinking mental health. there's going to be a component of this. She feels ashamed. She feels overwhelmed. Transportation's not reliable. She's afraid of failure. All right, so this is where our brain starts going, right? And now we're going to take all of these in the worksheet B, all of these amazing questions that Tessa has put out there for us. So what I'm going to have you do, we're going to start with capability. Go through the questions that we're going to kind of ask ourselves. So do they have the physical, mental abilities, skills, knowledge? Go through those questions. Again, I'm very active. I don't know if you can see it. I circle where you can't see it, but I circle where it's an opportunity for us to put some interventions. I put check marks next to what are strong strengths. What do we have in place already? So that helps me frame my thoughts. With our team, we do that part together sometimes. So when you're looking at capability, what are you seeing? Physical capability, psychological capability. What do we got? Julia, yes, we do the full combi outside of staffing. We do the mini version in staffing if we have something that is more imminent, but we do this outside of staffing with our court staff or in a case conference. And then we present the results in staffing. It's part of our notes. So what are you seeing for enablers and barriers? What light bulb moments with the questions? Unreliable public transportation. She seems physically capable. Yep. She's done it before, right? So what might be going on that's kind of preventing her from staying on top of everything? So we've got that mental health component, that psychological component, that fear of failure, that feeling ashamed. Yes. So I also wondered, is there depression? Is she overwhelmed? Is she just too tired at the end of the day? Because it said she's working now too. So we might have to ask some of those questions, or we might know some of that. She might be working a 40-hour work week, trying to make all of the appointments and court and see her kids, which is something a lot of our participants go through. So that might be our first kind of opportunity that I'm going to jot that down in my brainstorming section. Yes. So much superwomaning going on in our treatment courts. So now we start to look at each of the other pieces. We go through all of the enablers and barriers. Give me some of the other ones that you're looking at for enablers. Psychological, I know I had a lot of them circled. Yeah, she's a DV survivor. So think about the trauma responses that she might have from a little bit of shame. It could be a lot of bit of shame for her. So enablers are where we start to look at some of our opportunities. So what did you find in the enablers might be things we can put in place? And I'm looking at page 2 of 6, if that's helpful. So I'm still on capability. One of the big keys for us as a group using this was really going through the worksheet B and going through each of the keys. Tessa really formulated this around FTC participants in a way that just, it opens so many light bulbs. Emotional connection with her children, absolutely. If this is something she's really connected to, we're going to capitalize on that. That might mean text messages asking how visits went. Our participants share pictures and we include them in our staffing reports. So they know we do that. So they love to send us pictures. We always, respond back. We're always thankful for that connection and for them giving us the privilege of us, including us in their lives with their kids. So we know that she's also a trauma survivor. So some of the enablers that are on here, the different types of therapy, CBT, clear repeated explanations of core expectations. Judge Deep has a few things that we know he's going to share 400 times because it's just a normal part of court and expectations. they remember that. So they know what the expectations are. It's been drilled in their head. Sometimes people need that. We know her recovery supports are lower. So can we get her into something peer support related rather than a scheduled recovery group? Barriers. There's that trauma history there. So let's look at opportunity. Same thing. Take a minute, go through the questions. What is it about the environment that supports or allows the behavior? Do they have time to do it? What are the time barriers that may be getting in the way? We already talked about transportation. What else might be getting in the way? And Tatiana, what would you have in the opportunity category? And for everybody following along, we got page 3 of 6 going on over here.
Under the opportunity category, I did have the unreliable transportation in there. That's what I had written down. So
Yeah.
like that's part of her environment that doesn't support if she doesn't have that transportation to make these appointments, or even the time if we talked about like the different information that might be like different pertaining to people. If this was one of our participants and we knew she was working, so her time was limited, there's so many different things in there depending on each individual.
And we have this situation with some of our participants. So we're a court that's in a city, but also has a rural area too. So we have 2 locations in our county. We do have a virtual site that we flip flop. So we're running into the transportation issues all the time. You know, some of them don't have stable internet as well to use the telehealth opportunities. So we really try to get creative. So that might be part of the brainstorming plan. And in motivation, talk to me about what you're seeing there, going through those questions, enablers, and barriers. I'm pushing us a little bit because I'm watching the clock too. Lack of time management, problem solving skills, especially since she's overwhelmed. So the enablers are opportunities that allow them to be successful. So what Tessa did in each of the categories was, so with capability, opportunity, and motivation, the enablers are things that enhance their capability, opportunity, and motivation. So for example, they're in under social opportunity. Do they have encouragement from their team members? Are there positive peer mentors? What's the family system look like in terms of support? So yeah, you can look at it as recovery capital as well, I think, in most of the areas.
Yeah, I think you can use it as strengths finding, right? What areas are their strengths in each of these categories? You can also look at them as like ideas, like things that might not be there, but if you could build up kind of like protective factors, like that line of thinking, things that might be missing that you could build up to help support them.
If I've circled it, I will probably put it in the action plan for us to consider in the brainstorm section for us to consider in the action plan. So motivation, what do you guys think? How motivated is she to make these changes? Tatiana, go ahead and jump in.
I was thinking of like how to word it because there might be like the lack of motivation because she doesn't have that support, but also the lack of motivation might be coming from, it seems like, you know, this is a repetitive behavior for her. So like this has worked for her in the past of like missing appointments, sitting out from certain things. So she's like, okay, like I know this is gonna work. Why am I gonna motivate myself or have motivation to go an alternative route and continue to attend when, you know, she tells herself, I know she knows how to attend appointments. She can get back into that. But for right now, she's kind of again just enabling herself that this is okay, this worked this time. Not looking at all of the factors and what barriers it really is causing.
Yeah, and I know when I looked at this, we know she's upset. We know she's feeling disappointed. We know she's feeling withdrawn. So sometimes those negative feelings can be an opportunity to build connection. And that's what this kind of helped me to kind of look at was, all right, we're starting to see isolation. Maybe part of the tool is the action plan is connection. So what does that look like? And one of the things that as you kind of move through this, and I'm going to push us a little bit, when you get to worksheet C, once you mark all of your areas, there's some really simple tools like writing those written plans. I might have her do a priority list. So talk to me about like what's on your list. So if work is up here, which we're seeing a really big shift with that, where people are really prioritizing work, um, we start to talk about that. We start to gain more understanding of, what's the financial situation? What's the money look like? Okay, what are the consequences if you don't attend these appointments? We get their perspective on it. And also, we might have our department crew have that conversation. Here's why this is an issue. Get really specific with that. So, once I've narrowed down those categories, my worksheets are a little out of order. I use the checklist. This is page 2 of the behavioral change flow chart. Almost always I have all of them checked. And I'm taking notes. I'm writing things down to go in the brainstorm. Once I get to the brainstorm, I'm writing it all down. That's so that we can present it to the team. Like I said, I don't like to be prescriptive of what other roles do. So some of the brainstorms, write the schedule down, write the expectations down, validate. So if we're going to do immediate positive reinforcement, it might be every court appointment we're celebrating the appointments she did attend. We might be asking, I would love to, my camera is not focusing on that because the
I'll
glaze
screen
thing is
share
on.
it. Is
Thank
it?
you, Tessa. Um, family therapy, because one of the parts of the situation was the resource doesn't believe she can be consistent. So maybe they need family navigation services where that um, family member is working to understand the recovery process and what support looks like differently. So DBT, trauma work, REBT, those were all on the brainstormed ideas. So then we take that, we bring it back to the team. We're like, give me more other, if you guys have other ideas, if you more something else came from the combi for you, let's narrow it down. When we get to the explanation for the parent, we try to start with the validation and the why. Here's why we're having this conversation. Here's why we're meeting with you, whatever that might look like. And we're going to validate you have taken a lot on your plate. You are trying to work and maintain these appointments. We're looking at that priority list, and then we're going to action plan together. We came up with some ideas. I'd like to know what your thoughts are on this. How can we work together? What do you need? Do you need a text message reminder? We have in-person court in each location every other week. Do you need a reminder for a couple weeks that it's a Utica week or a Rome week? And we're going to really work together on it. So it's kind of the gist of it. And then I like to go to, oh boy, there's 2 that I like as kind of just a self-check, the accountability approach. Like this is my little checklist of, did we create an understanding impact? Did we create a growth opportunity? How's the participant responding to it? Was the process transparent, respectful, active? Does it create support? Is it considering the environment? Does it empower them? Is it going to help them move towards their long-term goal? Thankfully, we're very lucky. We don't fall into the punishment approach hardly ever. The other thing I like to do is that team versus parent responsibility. I do a checklist. Here's what we're committing to on our end. Here's what the participants committing to on their end, and you can just do check marks. This is another great sheet to do directly with the participants. So that's the process in a nutshell.
Wonderful. Thank you. Thank you. Well, I know we're running low on time, so I do want to go to Q&A. So I know there are a couple questions. So we talked about multiple categories.
I think
The question-
Sherson's was the first one. It's all the way up a little bit.
Thanks for chatting, everybody. Appreciate it. I like seeing all the chats. So hi, Shersten. this is really asking teams to think differently about supporting behavior change. Yes, that's the goal. Love it. We tend to resort to what we know, usually incentives or sanctions. So true, but there's this whole other toolbox of ideas informed by behavior science. Have you found this toolkit to help the team think differently and shift away just from, okay, our options are to provide a sanction or an incentive, um, and think more broadly? And does the toolkit help kind of come against this process being so difficult to think outside that box?
Dan, I'm going to toss that one to you because you have been so much newer to kind of feeling how it goes. How do you feel like that's shaping the conversation with the team and facilitating change?
I think it's engaging everyone a lot more, and it's really opening up more conversation, like deeper conversations, not just like streamlining base level. I think that it's really opening up everyone's ideas, and it's very opening to everybody, like for like our treatment facilities, um, our partners, everything like that. It kind of like allow each section could like correlate with every other place that we work with. So it does give them like the space to talk about it rather than like if it was just directed just at treatment. But there's so many different things to it that allows like kind of everyone to be a part of the conversation.
Yeah, and I think again, we're very lucky that we don't fall into that sanction boat. It's creating a lot of therapeutic interventions. And what's actually helping even more? So, Kirsten, this is a fabulous question. When participants don't understand why they have to go to certain appointments, why you have to go to parenting classes, or why you have to go to substance use treatment, it's also helping us narrow down on that why. And that's huge. So, the opportunity to bring more clarity and transparency and connect the expectations and really frame it into the parent's goal has been huge. I think it's making it easier, even though it's adding more time.
Do you think this model creates more opportunity to address the root cause issue for participants and some of their poor behaviors? Have you seen any more long-term success? I know you've only been doing it for a couple months, but I also know, so Ambi gave me many accolades, which I appreciate, Ambi, and she helped out, help gave a lot of input on what a real life team would benefit from, reviewed a lot of the scripts and the videos, and gave lots of suggestions on those comedy questions. So Ambi is a big part of this as well. So I know you've been thinking about this longer than just using the toolkit for those 2 months. So yeah, what do you think about that question?
Oh, give me the question again because
Yeah, do you think it creates more opportunity to address the root cause issue? And have you seen it lead to any more long-term success because of that?
Yeah, I think the participants really appreciate it, and that's where the success comes from because we are looking at the root. We're helping them kind of key in on the root, and that's huge. Um, so I think that's been the biggest piece is it's also building that rapport. It's giving them space to work with us on therapeutic interventions rather than stop it or you need to attend your appointment. Because again, it's it's natural for it to enter our mind. So it's I think long term we're seeing the increased rapport building. We're seeing participants feeling seen and understood.
Time for one more question. Does anyone have one they would really like an answer to? All right. Well, I'll give last words. I have a couple of resource slides to share with you all, but last words to Ambi and Tatiana. What do you wish if people were going to do one thing as a result of our conversation? What would you wish that would be?
I think it's the obvious. Try the toolkit with at least 5 cases. I think you'll see the benefit after one, but after 5, you start to figure out how it's going to fit into your flow. It's become a natural fit for supervision and staffing for us.
I was gonna say about the same thing, like because you don't, not that you wouldn't get it at first, but when you keep trying and trying and trying, the flow just makes it so much easier and it's gonna become more natural. But definitely continuously reusing it.
Thank you both. I think my encouragement is to think broader of incentives and sanctions, and recognize there's a lot more tools in our toolkit that are backed by science and backed by the evidence. If you're really into this, I encourage you to explore that human behavior change project. There's so much great information in there. So please enjoy that. I'm going to share my screen one last time. Share a couple of these last slides. Okay. So again, here's our resources that are available. You'll have the 5 short videos, again, 20 minutes total. If any of this felt a little disjointed, please know there's a lot more information in the videos. That is the intention, that you can watch the videos, look at the toolkit, and then watch this recording as a package of materials. So please go back and review those videos. Again, great lunch and learn opportunities. You have the behavior toolkit now. Use it as will work for your team. And then this conversation, and I saw a request for the slides as well. We'll get this recording and the slides posted on the website soon. So everything except those 2 things are live now. Please share with anyone. Here again is our evaluation survey. If you can click this QR code, or we'll drop the link again in the chat, and let us know your thoughts, future trainings or topics that would be useful to you, those sort of things. Please do that now. We really appreciate it. We also wanted to share that we have a research and evaluation team here at Children and Family Futures that can help you measure. I know we were talking about long-term outcomes and whatnot. Rhett has more than 25 years of experience, and can help design and implement evaluation methods, build collaborative capacity to collect and use data, and develop data-driven messaging. Something we know all of our teams usually could use some support on. So please reach out if that's of interest to your team. Here is a QR code to our CFF listserv to stay up to date on new resources and webinars, anything like that that is out there. We share grant opportunities, all those sort of things. So please subscribe there if you haven't already. And here's our QR code to contact us for any training and technical assistance you may need, questions about this. We'd love to hear your successes with it, suggestions for next iterations, anything like that. So I'll leave this up for a moment, and just want to say a big thank you to Ambi and Tatiana, and also the rest of your team, Darcy and Kristen, and everyone else who's been willing to try this out. A big thank you to you, Ambi, for being a thought partner in all of this as we do this work. And we really hope that this is something beneficial to your teams and to the field, and of course, ultimately our families. So thank you all for attending, and we hope you have a great week.